everyone. Welcome to TD Pharmacy Services YouTube channel. I am so thrilled to be here today with Dr. Madison Riojas. Dr. Madison Riojas is an infectious disease specialist pharmacist, which is an awesome thing, especially right now. I met Madison a few years ago working in the hospital, and I've been really impressed with everything she has done. And with that, I would like to have her give a little bit of introduction to our audience.
Hi, really excited to be here talking with you all. I am infectious diseases and antimicrobial stewardship specialist. So really what that means is I help with all the various infectious diseases and make sure that we're using our antibiotics and antivirals to be the best stewards and using them the most appropriately for our patients. So I really love the job. It's a great opportunity, and it's been full of learning lately.
And Madison is an amazing knowledge for me. Like, she has so much knowledge. She's helped me so much through the years, understand especially what's happening with COVID. She was very instrumental in helping us with remdesivir last year and everything that has been rolling out. So I have been really happy to pick her brain. So I'm happy y'all get to hear from her today. So Madison, I just want to know, what is the current state of COVID and flu in Oklahoma? Because I feel like it's changing. So this is recorded on 12/1. So it might change tomorrow, but I would love to know what's happening with COVID and flu today.
Yeah, so luckily the hospitals actually started to see a downtick in our cases. So we have some graphs that we look at periodically, and this summer we saw a big spike, and we've actually seen a big downturn in the amount of positive patients that we've seen for COVID and flu. I think that a lot of that is probably due to vaccination, because most of our patients that we're seeing coming in are not vaccinated patients, or they're significantly immunocompromised, making them more at risk even if they are vaccinated. I think that the general numbers in Oklahoma, we are seeing a very slight uptrend, and I'm not completely shocked by that, because it is the holiday season. It's the time of gathering and spreading germs, which is usually what we see with flu. And that's the big reason that we see the flu season when we do, is because we're all getting together and we're all getting together inside. We've seen a lot more flu B than we have seen flu A. Very anecdotally, I can't speak that on big numbers, but in my patients that I've seen much more flu B. I've seen people that are positive for flu and COVID though. So just getting one doesn't mean that you just have one. That's really what I've seen. And I kind of expect to continue to see a little bit of an uptick, because like I said, we're approaching more and more into that holiday season. But
yeah, for sure. And, with that, knowing that you can get multiple viruses, you can get bacterial infections as well if you have COVID. So there is a big push across the nation to not just test for COVID alone anymore. And especially when it comes to flu, you definitely want a PCR test. So you're going to start seeing a lot more people offering multiplex testing, especially after the first of the year. So can you tell us why it's important, to get a multiplex test, which means you would test for COVID, flu A, flu B, RSV, all in one swab. So it's not 4 different swabs or anything crazy like that. It's just one.
Yeah, and it's really important because the symptoms are so similar, especially early on. You have fever, you have cough, you have shortness of breath. All of those symptoms can be seen with any of those viruses. And really that initial presentation of any of them is very, very similar. If you're just getting tested for one virus, then there's nothing to say that you couldn't have one of the others. And that's important because you're contagious with all of those viruses. Flu, every year we haven't necessarily worn masks or really practiced any kind of social distancing. But as soon as we started doing that, we started seeing the flu numbers come down. Last year's flu season was remarkably low. And I think that that's really because of the hygiene practices that we started doing. So by getting tested for all of these viruses, if you're spreading any of them to anybody. And I think that that's just really important from a public health perspective, because the mask recommendations have really loosened up. And so this year we're not nearly as protected as we were last year going into grocery stores and different things like that. And so the risk for all of these different viruses is much more substantial than maybe it has been.
Yeah, no, I absolutely agree. And with that, you if you do test positive on a multiplex and you do have, COVID and you also have flu, there's treatment options. And I think sometimes people forget that, these are all treatable if caught early.
Yes. And that is one thing that's very characteristic of viruses in particular, is that the antiviral drugs that we have need to be started soon. The most data is in Tamiflu, because the flu's been around the longest. So the drugs have been around the longest. So what we know is the earlier you get tested and we know that you're positive for the flu, the sooner we can start that drug. If you've been positive for too long or you've had symptoms for too long, sometimes we won't even give you the antiviral because it's no longer even effective. And don't want to really just impose a cost if it's not going to give you any benefit. But the earlier you can start treatment, the more benefit it's actually going to have. And that's really the same for remdesivir. The data coming in is just more and more consistent with a very similar to Tamiflu presentation. So, as soon as you have symptoms, if you're getting tested, there's multiple treatments, whether it be the monoclonal antibody treatments for those very, very early on exposures or no symptoms yet, or if your symptoms are significant enough to present to the hospital, we would get you started on remdesivir as soon as possible, because that's where you're going to see the benefit.
Yeah, absolutely. But, our goal and your goal for sure is to keep people out of the hospital.
Absolutely.
So we would really prefer to use, one of the monoclonal antibodies like REGEN-COV. And one of the coolest things I think right now is that pharmacists can actually administer and order monoclonal antibodies. So this is a really big thing that's helping our communities. You no longer have to go just to the health system. You have your independent pharmacies out there that are able to come, to your home and provide you with therapy to keep you out of the hospital, which is the ultimate goal. So like Madison said, definitely want to test early if you're feeling bad. And try to get those treatments to keep yourself out of the hospital. Another amazing thing that I found, especially, working in the hospital and listening to a lot of statistics over the last year, is that it costs $80,000 on average to enter the hospital and have COVID because your acuity, the amount of care that you're getting is just so high. And you're usually there for multiple days. So we would all like to keep people out of the hospital. So now there are treatment options in the pipeline. Do you want to talk a little bit about maybe the pills or capsules or whatever version they're going to be coming out soon?
We're very excited about that. I can't say that I know a ton about what is exactly going to look like, not until we get all of the studies out there and of course all the data, but it's very, very promising. In my mind, I'm expecting it to be something similar to like a Tamiflu. If you test positive, you can get that prescription, you can start taking it immediately at home, and it'd be an oral option. Honestly, having an oral option would be amazing, because people having to stay in the hospital just to get their IV drug is just ridiculous. If you're beginning to have improvement, we will really want you to be able to get that treatment at home. So being able to have that option, I think it's going to be revolutionary.
Yeah, no, I absolutely agree. I think it's going to help our health system, our, pharmacists who are working overtime, and our physicians too, that are very, very stressed. So I'm excited about having an opportunity to treat patients at home. So one question that I see frequently from my friends and my followers on Facebook is the fact that people can test positive on a PCR test after recovering from COVID. So what does this mean, and what should patients do if they're in this situation and say they need to travel, or they're going to have a procedure after they have technically recovered from COVID?
So that's an incredibly common finding. Most of our patients actually in the hospital will continue to test positive while they're admitted. And one question that originally got brought up is, when are they not contagious anymore? When do they need to stop being in the isolation? So the CDC has come out with guidance as far as that's concerned, and that's really at 21 days from your first positive, you're likely not contagious any longer. You're considered what we consider a recovered COVID, but you might still be shedding enough virus to make the PCR test positive. One thing that a micro lab in a hospital system could potentially do is run what they call a cycle threshold. So you run it through a test, and you see how quick it will turn positive. So if you have to run the test a bunch of times, then you have a very low, or you have a very high cycle threshold, so you have a very low viral load, and you're not contagious. It's not an active disease at that point. If we run the test and it turns positive immediately, then it's an active case. And so that's a very sophisticated microbiologic diagnosis for that. But I think that it kind of helps us understand, when these tests are continuing to be positive, it doesn't necessarily mean that they're hugely positive. It could be just a little virus fragment. And a PCR test picks up a live virus and a dead virus. So it doesn't necessarily mean that you're actively infected or that it's active virus. So if you've been positive, you've been treated, or your symptoms have gone away, you're 21 days out from your first positive and you're still positive, you're not really positive. So that is just to say peace of mind. A lot of times if there's anything compromising your immune system, even just a little bit, then you might continue to stay positive, whereas somebody else might clear it quicker. So there's your peace of mind as far as coming in contact with other people. If you're needing to travel, it might be beneficial to continue to keep your positive results, especially from your very first one. Being able to document when your first test was and when your 21 days is up, if you're still positive, being able to document that change in dates is very beneficial, because that allows, healthcare workers or anyone, if you're traveling, I can't speak to what various countries or like anybody's policies are going to be, but I know as far as like healthcare is concerned, it's important for us to know if you're recovered or not, as to whether or not to put you in isolation. So that would be my recommendation, is just keep track of everything and know. And then now, once you're at 21 days, you're not shedding.
21 days of asymptomatic.
Exactly.
You're not shedding. So PCR tests are amazing at picking up viruses. And that's why we recommend them to our patients, because they can detect even the smallest amount. And so it's important for early detection. But one of the downsides is that, after you've had it and you're having to travel and use a PCR, you just need to know that information, just to hold on to everything that is given to you by your doctor or pharmacist. So one thing a lot of our viewers might be interested in is variants.
Yes.
And as of today, December 1st of 2021, we have the Omicron variant that we know has entered the United States and is in California as of today. So with this variant, what do you predict as far as Oklahoma? What's going to be, what do you think is going to happen with the variant, and when do you think we're going to start seeing it across the nation?
So the issue with the variants is it's very, very hard to predict how they're going to respond. For instance, Delta really hit everybody very hard. It hit younger populations. It absolutely terrorized non-vaccinated populations. We even had some little kids that got the Delta variant and got very, very sick. But then we had the mu variants show up and we were all very worried about it, and then it did nothing. So the issue with variants is that it's a mutation in the spike proteins, and that is what makes it look different, and what makes us separate them out from each other. The one good thing is the way that the vaccines work, especially the mRNA vaccines, is they're targeting those spike proteins. So the likelihood of the vaccine continuing to work even against all these variants is very, very high. Because while there's mutations in the spike proteins, they're not significant enough to be different enough to not be covered by the vaccine. Obviously, I can't predict how this is going to go because we haven't tested it against the vaccine. But what we know about the other variants is that the vaccine has continued to be very effective because of where the mutations are happening. So I think that anytime we see a new variant, we need to be on the lookout for it, not necessarily terrified of it by any means, but being very conscientious of our mask wearing, conscientious of who we're around and what exposures we have, and vaccine status of the people that we're spending time with and who we could be bringing things back and forth to, because an unvaccinated person, regardless of what variant it is more at risk. So if this variant is more aggressive, then maybe you're vaccinated, maybe you're taking it to somebody that is not and more at risk. So I think just really being aware of where it's spreading and just the status of everybody that you're in contact with.
I think that's really great advice. Me and Madison working in hospital, we were vaccinated almost exactly a year ago, which crazy. Is amazing. So yeah, we were definitely due for our boosters like this summer when before people were giving boosters. So that's, it brings up another really great topic because we do know that vaccine against anything that's viral is the most effective way at preventing it. So, right now we do have vaccines against flu and COVID, and both of those things are kind of happening. People getting their boosters, people getting their first dose of COVID vaccines along with the flu vaccine. So, I think that's very important to everyone to make sure you did get your flu vaccine. If you're over 65, make sure you got your high dose flu vaccine. And if you have not got a COVID vaccine, we both recommend doing it. And I know that everyone has opinions about it. And I do respect your opinions, but it is the way to keep you from getting it. And then if you are immunocompromised, if you're a healthcare worker or anything like that, make sure you are getting, your boosters, because we do know that that's important as well. One thing I do want to talk about is, and as far as vaccine goes, is that there's a very special population of people who early on, they said, hey, don't get the vaccine. And now they're saying, hey, get the vaccine. And that is pregnant women.
Yes.
And can I tell?
Absolutely.
Okay. And Madison is expecting a little baby boy. So yay. And so she is 19.
Yeah, 19 weeks.
19 weeks. So she got her booster while she was pregnant. So please educate all our viewers over vaccine and pregnancy, because I'm very interested to know.
Yeah. So it's definitely become something that's very near and dear to my heart, and something that I very much researched thoroughly before going through. So initially, very early on, there was the recommendation not to give the vaccine to pregnant women. And I do just want to clarify why that recommendation was there and why it changed. It didn't change just because of a whim. It changed because we got more information. So testing these vaccines and any drugs, you generally start with a non-pregnant adult healthy population. And then you move from there to other patients that are going to fall outside of your normal category. So there were several women that became pregnant during the trial or after getting the vaccine, and we were able to actually test for antibodies in those women and see the results of how their babies did. And they were fully aware of everything. So the recommendation changed when the amount of data changed. So now we have lots and lots of data to show that the vaccine is completely safe in pregnancy. The flu vaccine also is completely safe in pregnancy. We've known that one for a while, but just to throw it in there. And some really encouraging things that we've seen are that these babies that the mom gets vaccinated while she's pregnant are being born with the antibodies.
That's amazing.
So our babies are being born protected from COVID, which is huge because they're at risk for everything when they're born. And it's also been shown to be pregnant in breast milk. So, if you didn't get your vaccine and you've already had your baby, it's not too late. You can get your vaccine while you're breastfeeding and get antibody to your baby at that point as well.
And that's fantastic.
It is, especially since kids can't get the vaccine until they're a little bit older, just because, again, the amount of information that we have. I mean, they're not going to be getting it for a couple of years, and they're still at that at-risk population. And so being able to give them a head start with that is just, I think, a huge advantage for them and very important.
Yes. And, I think overall, that's a very important thing, especially the first 30 days.
Yes.
Yeah. That's where you give all your baby their immunity. Let me get my words out. You give your baby their immunity during that first 30 days of, breastfeeding. And, there are some people, unfortunately, that, they want to breastfeed, but they can't. So are there options for these women to be able to give their baby the immunity that they need in that first 30 days?
Absolutely. If that's the category that you fall in, you should absolutely look into getting donated breast milk, because there are options to donate not COVID positive, but COVID vaccinated breast milk. So that could be potentially an option.
Yeah. And I love that. So yeah, there's a potential to get COVID vaccinated breast milk if you are unable to breastfeed yourself. So your baby can be protected just like Madison's baby. So, well, Madison, I appreciate your time today.
Yes. Thank you so much for inviting me. And this was great.
Yes. So Madison, if our viewers were, looking for more information or resources, where should they go to find more about infectious disease and all the cool things you're doing?
Me specifically, or infectious diseases in general?
Well, I mean, I guess infectious diseases in general, and you as well.
Well, I always point anybody to the CDC or the IDSA website. So if you're looking for more information, if you want to know anything more about anything that I mentioned, every fact that I gave you is backed up by a recommendation from the Infectious Diseases Society of America, or the IDSA, or the CDC, Center for Disease Control. So please feel free to Google either of those and look into that information more. But if you have any questions for me specifically, then feel free to reach out to Tara and she'll send your information on to me.
Yes, that's perfect. Okay. Well, thank y'all and have a wonderful week.